Good afternoon. This is Thalia MK at Health 2.0 Conference 2024 Dubai, and we have with us John Baptiste Belge.
Yeah.
Correct. And he is the Director of Neuromodulation at BRAIN-NM-Clinics, and he has been awarded as an excellence. First of all, congratulations and thank you for being here. We'll get to know more about you, but how does it feel to be recognized all the way here in the Middle East, in the middle of the hub of everything?
Yeah, well, it's a fantastic feeling. After all the hard work we did with the team in constructing a startup, BRAIN-NM was a startup 1 year ago, and now we are scaling up. So this is a fantastic recognition for all the hard work we did.
So what does your company is known for or stands out for?
Okay, yeah, so our company BRAIN-NM-Clinics is the most advanced neuromodulation clinic in Europe.
Okay.
And so what we actually do, we propose ways to treat neuropsychiatric disorders without using traditional medication. So what we do is actually we use advanced technological devices, mainly transcranial magnetic stimulation, deep transcranial magnetic stimulation, and ultrasound to actually cure and treat disorders like depression, obsessive compulsive disorders, and things like that, by targeting with these devices, with this magnetic stimulation, very specific brain regions.
So is it like electric waves? Electronic, like people have that mask on, like electronic waves. I've seen it in movies. So
Yeah,
I'm not aware of it.
Yeah, what you're talking about is electroconvulsive therapy. You know, the ancient electroshock therapy. It's not that. What we do is actually a very strong magnetic field. So the magnetic field has a strength of like 3 Tesla. It's like the strength of the Earth magnetic field.
Wow.
And it's also a method that is FDA approved. There is a lot of research about it. I myself, I'm also a researcher. I'm a professor at the University of Liège in Belgium, and I'm doing a lot of research about it also. Yeah.
Bravo, that's awesome.
Thank you.
So when it comes to, it's a very sensitive topic because when it comes to health or law, all the countries have their own regulations and pros for it or what they are against to. When you can compare it to Europe, there are variations. So how do you deal with the challenges when informing the new country, like now, your product? What are the challenges your company faces?
So I think the most important challenge is actually awareness. So I believe also for you, the fact that you can treat neuropsychiatric disorders without medication, but by using focal treatments very selected to a specific brain region is quite new. So the first thing that's always difficult in a population that we don't know is raising awareness about these methods. That's very important. So that's the first thing. And then second, indeed, from a legal point of view, we have to see if the technique is accepted by the specific country. So there are many regulations, but as it is FDA approved, it's mostly all right. So
nowadays people are very much woke, I would say, due to the help of social media, and everybody is now more vocal when it comes to depression. Before, these things were taboo. You cannot talk about it.
That's true.
But for an example, if a person comes from a place where they are not well aware of what is going on, they might be having an anxiety issue or depression. As a patient, how would you or your clinic deals with it?
Can you repeat?
Yeah, it means, for an example, as an example of a teenager, he doesn't know that he has depression or anxiety or what kind of help they need. Even the parents don't know. So what are the steps your company or you take to spread the awareness, whoever is watching, so they're now well aware how to go ahead with it?
Yeah. So first, when we see a patient like that, first we do a diagnostic build-up to see what is the exact diagnosis. We evaluate the symptoms. We are using AI also to do that, to have really a very specific symptom profile. And then we explain everything to the patient and to maybe the parents of the patient, so they are aware what is going on. But then we explain the neurobiological mechanism of such a disorder or such a symptom, and then we propose a treatment that can adapt by adapting the neurocircuitry of the symptom, this pathology. That's our way that we are working. So everything is about the fact that the patient should know everything we know. You know that
the transparency is there, which is very important.
Yeah, absolutely.
Health is something like people are not aware. This is a very new technology, very inventive. How did you or your company came up with this idea? What was the build up like?
So as I said, I'm a researcher, so I did use these techniques before that in research a lot, and we have very nice results. For example, for a depressive disorder, when you use medication, you will have a response rate of maybe 40%.
Yes.
It's not that much. With neuromodulation, magnetic stimulation, you can obtain 90% of remission rates, yes, by using advanced protocols in 1 week only. So you can cure people of depression, 90% of these people in 1 week. And I was like, it's very sad that all these technologies, all these things exist, you know, in research, and that we cannot deploy it in the clinical field immediately. And so that's why actually the BRAIN-NM-Clinics is really a link between academia and clinical practice, so we can accelerate actually this trickle down from research to the clinic. That's why we came up with this idea of BRAIN-NM-Clinics to accelerate this process.
That's really very interesting. As you're here, like if anybody wants to approach or provide, like avail these services or product, how they can reach out to you, and what are the pointers they have to keep in mind before reaching out that you would, as a company, would require from a client?
Yeah, so mainly we have an intake office, so if someone is interested to contact us, they can contact our intake officers. We have a lot of social media, Facebook, also LinkedIn.
Can you say some the names so that they can have a...
Yeah, so we are on Facebook, we are also on LinkedIn, we are on YouTube, we have our own professional websites. We have a lot of intake officers, so the contact is very easy. When you type BRAIN-NM-Clinics, you will find it everywhere. We have a marketing team that's doing it also, so no problem to find us.
You were already a researcher, you are well aware of so many things. How was your experience in researching in Health 2.0 conference so far?
Can you repeat?
You're a researcher yourself, you're well aware of so many things and inventing new things, and now you're being here. How was your researcher experience in Health 2.0?
No, it was an exceptional experience. I really loved it. I would be glad to come back at the moment, maybe in the States also. No, it's very great to see people who are really developing things that help other people. So it's fantastic.
It's a pleasure having you. Congratulations
Thank you very much. Thank you very much.
Remember, be healthy, be kind, be safe, avoid using plastic and wastage of water. And this is Talia MK signing off. Thank you.